Welcome to WSIC Dashboard's Asthma Radar demonstration video. The Asthma Radar can be found under the Long-Term Condition Management product and by clicking on the Asthma Radar icon. There are a number of different risk factors for asthma attacks, and it can be sometimes difficult for clinicians to check each one of them during a consultation. The Asthma Radar has been designed to classify risks into a red flag status, to help clinicians easily identify patients at risk and identify patients whose care needs optimizing. Patients with risk factors identified should be reviewed by a doctor or nurse with specialist training in asthma care. The Asthma Radar allows the user to select which network or practice the user is most interested in. The age band filter allows the user to select patients within a particular age range, and the patient segment filter is another very useful filter to enable the user to select cohorts of patients with particular health needs who also have asthma. This allows the user to proactively target patients and manage them effectively. For the purpose of this demonstration, I have selected adults with advanced dementia and learning disabilities. The Sort By filter allows clinicians to sort patients by a number of parameters, including number of red flags, number of risk factors, number of exacerbations, number of A&E or urgent care centre attendances, or age. The following filter allows the user to focus on patients who have had an RCP review within a particular year. Based on our current selection, this section allows us to see the total number of patients who fit the criteria we have just selected. Should you wish to focus on the top 100 or top 50 patients, you can do this by altering the number here. The Asthma Radar is based on the familiar concept of red flags or RAG rating indicators. Within the first section of the Asthma Radar, alongside the patient details, you will be able to see the number of risk factors. Where multiple patients have the same value, they are ordered by NHS numbers. Some risk factors weigh higher than others. For example, these are FEV1s less than 60%, food allergies, poor inhaler techniques, major psychological or socio-economic conditions, and past severe asthma attacks. For more information relating to risk factor calculations, this can be found in our Asthma Radar user guide. A&E attendances, walk-in centres and urgent care centre attendances are a general risk factor. These are not specifically asthma-related attendances. Data could be more accurate if practices routinely coded attendances and admissions using clinical codes for that admission. The next column pertains to the number of exacerbations or attacks within the last 12 months. 2 or more attacks within the last year are designated red flags. The numbers within the indicators are derived from hospital admissions data, prescriptions or short courses of oral prednisolone, or where the read code H333 for asthma attacks have been used. Further read codes and calculated definitions of exacerbations can be found within the Asthma Radar user guide. The next section on the radar relates to the number of prescriptions within the last 12 months. Which includes short-acting bronchodilators, inhaled corticosteroids, and long-acting bronchodilators. Hovering over each indicator will provide you with more information relating to the number of prescribed prescriptions, last prescribed date, and practice where the inhaler was prescribed. Missing traffic light data indicates no data is available for this indicator. The asthma care section consists of 4 different categories. Red flags would be designated to asthma reviews if there has been no review within the previous year or no review since the last exacerbation. For inhaler techniques, red flags are designated to anyone who hasn't had their inhaler technique checked or if their technique is poor. The RCP3 questions is one way of recording symptom control. Other tests include asthma control test and asthma control questionnaire. Red flags will be given to anyone who hasn't had their symptom control assessed, or if their control is poor. A grey indicator relates to a RCP question with no numerical result. Half of those who died in a national review for asthma deaths did not call for help during their final asthma attack. Most of these people had not been provided with a personal asthma care action plan, which should have helped them identify the danger signs and know that they should have called for help. Therefore, red flags would be designated to someone who hasn't been issued with an asthma care self-management plan. The lung function section will consist of another two categories. Peak flow will display a grey indicator which indicates that there is a numerical result present. Hovering over the grey indicator will provide you with the results. FEV1 will show you the latest recorded result. A red indicator will reflect a result less than 60. An amber indicator will reflect a result between 60 and 70. And a green indicator will reflect a result more than 70. By clicking onto a patient record, you will be able to access the patient summary page. The Asthma Patient Summary page consolidates all the information available on the Asthma Radar for one patient onto a single page and includes any risk factors or long-term conditions the patient may have. The summary may be exported for printing or sharing if required. Hovering over the swim lanes will provide you with more information in regards to the event. The FEV1 and peak flow graphs are available for a maximum of the past 5 years. If you feel WSIC dashboards will be beneficial in supporting proactive case finding and improving quality of care within your North West London area, please request access by emailing nwlccgs.wsic.dashboards@nhs.net. Thank you for watching.